Good afternoon, everyone. Welcome to our panel, Misinformation and Challenges of COVID-19 in Our Communities, Perspectives from Elected Leaders. I am Madeline Milka, President and CEO of APEX, the Asian Pacific American Institute for Congressional Studies. And we are honored to be here with the Health Forum for our Voices Conference. So thank you so much for joining us. In this session, local officials will discuss the challenges and resources that they have found helpful to get information to their constituents about COVID-19, vaccinations, and how they are preparing for flu season. And so it's my pleasure to introduce one of our two panelists for our discussion today. State Senator Stephanie Chang is the first Asian American woman to be elected to the Michigan legislature and worked as a community organizer in Detroit for nearly a decade before serving 2 terms in the Michigan House of Representatives. She is a founder and board member of Rising Voices of Asian American Families and serves on the board of the Southwest Detroit Community Justice Center. Mayor Ron Nirenberg will join us as soon as he finishes his city council meeting because he's also the mayor of San Antonio, Texas, and we look forward to hearing his insight in his role in dealing with all of the issues that we face with COVID and upcoming flu season. So let's get started with Senator Chang. Thank you so much for joining us today. We really appreciate you taking the time to be here. One of the questions that we are most interested in knowing your answer to and in providing insight is, as a local elected official, how do you reconcile federal and state COVID-19 procedures and guidance with local governance?
Yeah, well, first of all, thank you so much for having me. It's great to be with you. It's crazy to think about the fact that we're, at this point, it seems like almost 2 years into this COVID-19 pandemic. And so we're certainly in a different place than we were when we first started. But as I thought about this question, I kind of thought back to, in Michigan, thinking back to March 10th, 2020, when the first COVID cases were identified and people were just scrambling to figure out what was going on, what was happening, what precautions people needed to take, and then all of the, different policies that needed to be implemented. And so it's been a little bit of a web, right, of a lot of different policies, and especially thinking about last year, it was a lack of policies coming down from the federal level, in terms of policies that made sense to really protect our communities. But, and then at the state level, really trying to make sure that we were communicating with our local officials about what was going on, what some of the state executive orders were, and so on. And then at the local level, trying to really work with our counties and with our cities and townships on the different things that they could be doing, and also to be able to answer people's questions. And so, I think back, so Michigan, just for background for those who are tuning in Michigan, our Governor Gretchen Whitmer used a lot of her executive powers last year, although at a certain, I'm trying to remember, I think it was in the fall, either maybe it was October or November of 2020, our state Supreme Court basically said that that the law that she was using some of her executive powers under was unconstitutional, the Executive Powers of the Governors Act. And so that really complicated a lot of things because at that point, many of her executive orders were nullified. And so then we had to, then the state really had to figure out other ways to be able to put in protections for people using public health orders rather than executive orders from the governor's office. So those health orders came from the director of our state's Health and Human Services Department. And since then, it has still remained a maze. Our state has passed a number of laws codifying some of the executive orders, but obviously we're in a different time now, so everything has sort of evolved. And then cities and our counties especially have really evolved as well. In Michigan, our county health departments have had a lot to do and a lot of it's been counties, I think in particular, and school boards have been a place of just a lot of controversy. So even thinking about masks and vaccines, with I just am thinking back to the fall of this year when schools were starting to go back into the school year. And we have a hodgepodge, unfortunately, across the state of what the policies are around students and staff wearing masks. And so I actually think it's been really, really important that our county health departments some of them have really stepped up to the plate and said, yes, we are going to require every single student, staff, et cetera, with some exception, in this county to wear a mask. But it has been not without controversy. And there's many counties throughout Michigan that actually have not instituted that policy. And because Michigan does not have a statewide mask mandate for schools, it's really left, I think unfortunately some students and families kind of in a bad position. And we see very directly, the result of this. The counties that don't have these mask mandates have higher spread of COVID and more cases of, K to young children getting COVID in schools and spreading it. So that's really unfortunate. But this is sort of where we are in Michigan. We've got a lot of misinformation still to combat. And our county health departments, our school boards some of them have made really, really challenging decisions. And so anyone who's in one of those positions, I'm just grateful to everyone who chooses to serve, because it is a tough job right now to serve at the county and local level.
Yeah, that's where all of this really happens, is on that local and county level. So you just mentioned that misinformation is still an issue for your state. What do you find are the best ways to combat that, and how is that possible? With a state that is also very diverse, how do you handle that in terms of in-language resources? This is basically how we'd love to hear those suggestions as well.
Yeah, well, we're all still learning, right? We're still figuring out what is the best way to do that. I think that, the district that I represent is a lot of Detroit and then also a lot of downriver. And so for those of you not from Michigan, basically what that means is that I've got a section of my district that is majority Black, and then I've got a section of my district that's majority white, and just kind of everything in between. We've got a very diverse district. And I'm just thinking back to the fall when I had one of my very first in-person events since the pandemic started. And I had a number of parents who came with their children who were very upset about the Wayne County, which is the county that I live in and the county that Detroit is in. They were very upset about this county issuing a mask mandate for children. And they had all of this, information that they were trying to share. It was really hard to have a conversation, but I think that in some ways we did sort of at least get to a place where we weren't all just shouting at one another, which I think is a good thing. But one of the things that I remember is that one of the parents who was I think she was actually a nurse, but she gave me a copy of a study. She, I think, really truly believed that masks have E. coli. She had read a study that was about masks and E. coli, and she handed me the study. And it turned out this study was based on 6 total masks that some parents, compiled and sent to a lab in Florida. And so I kind of, it made me really think about just critical thinking skills, the fact that, people don't necessarily understand, what a valid study looks like, and that someone gave this woman this study and told her that this is the truth, this is what's happening. And unfortunately, we have people who are believing this information, or the so-called information. And so I think that what we're seeing is this unfortunate situation where there's so many people who live in this reality where they're given some information, don't necessarily have or haven't or don't have the ability to, think about it and figure out if this is actually true. Clearly a study that's based on 6 masks is not a valid study. And so I struggle with this. But then I also think of another example. There was another woman who came to that coffee hour, and she was talking about the mental health struggles that her daughter was facing. And so I said, well, I agree that we've got a mental health crisis, and tried to really sort of pivot to the conversation about the fact that, yes, during COVID, we've got a lot of struggles that we need to deal with, especially when it comes to mental health. And she, for some reason, believes that many of these mental health struggles were related to her children wearing masks. And I tried to pivot back to the fact that, here's all of these other policy things that we need to do in Michigan to improve our mental health system. So that's just an example of trying to at least get to a place where you can have a rational conversation with someone about something that you can agree on. Unfortunately, I think for some people who believe some of the studies, so-called studies, I don't honestly know how do you you can throw back at them all the other studies of real information, but unfortunately I think that there's just still so many people who don't believe the truth, and so we've got our work cut out for us.
Well, thank you so much for sharing those experiences, and it is such it's a process of also meeting your constituents with where they're at. And so I want to continue that part of this conversation. And at the same time, also welcome Mayor Nirenberg here with us. Just as a intro, he is the mayor of San Antonio, Texas, which is the 7th largest population in the United States, and one of the nation's fastest growing cities. And he's the first San Antonio mayor to be of Asian American descent. And through his personal experiences, he has developed a core commitment to civic participation and the universal values of liberty, justice, and equal opportunity for every person. So we're very privileged to have him join us today. So, Mayor, one of the questions I asked State Senator Chang was, as a local elected official, how do you reconcile federal and state COVID-19 procedures and guidance with local governance? And so as one of the largest cities in this country, like in the top 10, how does that, what are the challenges you face, and how do you address that as a local elected official?
Well, first, it's great to see you, Madeline, and wonderful to join Senator Chang. These are certainly challenging times that have only been made even more challenging because of the battles that we've had between federal, state, and local. I will tell you, here in San Antonio, our major challenges have been to protect the life and safety of folks. Keeping people housed became our top priority. Immediately when the pandemic began, we saw a loss of income, loss of jobs, and that ended up with massive lines for food. And keeping people housed and making sure that they had a roof over their heads at the end of the day became our first funding priority, in addition to ensuring food security for the community. That has continued, and it hasn't stopped. We've allocated roughly $190 million in housing and rental relief for our community just to get through. The other thing is preparing to get back on our feet, combating the pandemic, and that includes containing the virus, lowering infection rates, making sure that our hospitals didn't become overwhelmed, but ultimately paving the path to getting people back on their feet, back in jobs. And that has continued. As we know, there has been a significant labor shortage for businesses, so businesses are struggling as well. That was true before the pandemic, where we saw massive underemployment. And so during the pandemic, we put a lot of our resources into a program that essentially provides living pay for people to go into training programs, short-term training programs for jobs that are available, because the Bureau of Labor Statistics was very clear about a quarter to a third of jobs that were lost during the pandemic might not be coming back for the next 5 years, if at all. The economy is transformed, so we need to make sure that our residents have access to transformative skill sets for the jobs that are available. So we began that effort. Voters approved an effort to continue that, because it's not just a pre-pandemic priority, it's also going to be part of our efforts going forward, because the economy has truly transformed. The last thing I'll say is, similar to what Senator Chang was talking about, is combating misinformation. This pandemic has been prolonged. I have no doubt that this pandemic has been prolonged because of the politicization of it. The misinformation about vaccines, the misinformation about mask wearing and basic mitigation efforts, that has been promulgated at the federal and state levels at different times. We have had some pretty significant legal battles with our own governor and attorney general on issues like being able to require masks in settings where people aren't able to get vaccinated, like in our public schools. So that has been a significant challenge. The way we deal with that is that we provide as much access to information and data as possible, and we put the science and the health guidance directly to our community, and we collaborate across jurisdictions and across sectors. So when the pandemic began, I and the county judge decided that we need to just get data and information to people as often as possible, good, bad, and ugly. So we began an effort and basically went on the air every single night at 6:13 to provide people an update on where we were with the infections, and it ebbed and flowed throughout the last year. We brought with us the medical experts, our public health authority, to tell us what we needed to do. And it was that consistency of information and that direct access to the science that allowed people to, number one, cut through some of the chaos. A little bit of consistency was very helpful for folks. It helped lower anxiety. But it also gave people the tools, the information that they needed to protect themselves, their families, their businesses. And for the most part, I believe that that's why we've been able to get through as we have. Of course, we have suffered just like every community, but San Antonio has been able to pivot and make changes to our guidance, our mitigation efforts along the way. We've had now, as we've struggled through Delta, we have now lowered the infection rate. It's been the lowest of any major metropolitan in Texas, perhaps farther than that, for the last about 2 months. We try to be factual, and when it is time to buckle down, we've told people that. When things can start to ease up a little bit on, for instance, occupation or occupancy for businesses, we've told them that as well. When there's new data, because this is a novel virus, so when there's new things that we are learning about the virus, we're very upfront and direct about it. Things change as we learn more and as the science dictates. So we've provided that information, and I think that has helped us build trust with the community that the community has responded to, and I think that is part of our success and why we're beginning to get back on our feet now.
Thank you, Mayor. I think I picked up on trust in the sense of how local elected leaders, because you're on the ground, you're very visible within the community, and that's not just within the Asian American community. Senator Chang, you talk about how your district is proportionally white and Black, and also in the sense of you're just there, very visible. So in that vein of being trusted elected leaders, we hope that we continue strengthening the democracy of our elected leaders and saying that they are trusted messengers and sharing what is best for our communities. How do we equip other trusted messengers across industries to have them out in the communities really combating that misinformation? What do you think are the best ways for us to equip them so that we can get them out there talking about the facts and being able to give them information that people can then make their own choices? Senator Chang, I'll start with you.
Yeah, no, it's a really good question, because as much as I think of myself and other elected officials, we all think of ourselves as really good trusted messengers. Honestly, some of the best ones are really, the local neighborhood associations, or the folks who are on the ground, helping people with many other things in their lives, just helping them even prior to COVID, many of the community institutions that have been so vital to our neighborhoods. And so I actually think, so in Detroit anyway, we know that there are so many groups that have been tasked by the city of Detroit and given some resources to actually go door to door in a campaign to really make sure that people have the information about the vaccine. And I think that's been impactful, although we still have a long way to go. Our vaccination rate is still just not where it needs to be at all. But we know that by going door to door, by actually having conversations with people and asking people what questions they have, that will hopefully make a big difference for people. I know that there's also the billboards and the radio ads and just the mailers that we've been getting and all of these things. I think there's nothing better, regardless of what type of outreach campaign it is, there's nothing better than just talking to someone at their home. And so I really think that those community groups that have been doing that work are so important, especially the ones who, when we've got folks who speak Spanish or are going into, our Latino neighborhoods talking about it, and others, being able to speak to people in their own language and bring that level of comfort to just really say, what questions do you have, and try to be able to help answer questions. I was talking with, not in my district, but in a different district, talking with someone who works at an FQHC, a federally qualified health center, who, there's a trusted messenger right there, right? So, and she said to me that one of the things that she thought was most effective was just saying, what questions do you have? What concerns do you have? And starting from there, and that she's been able to get some people vaccinated that, previously had just really not wanted to get vaccinated. And so I do think it comes down to those one-on-one conversations. And to all those who are having those tough conversations, I just applaud you, and, keep up the amazing work, because we've still got such a long way to go.
Mayor Nirenberg, what's been your experience in combating this misinformation?
Yeah, I agree 100% with what Senator Chang just said. And this is why the erosion of trust, deliberate erosion of trust in some cases, has been so destructive to our efforts to combat the pandemic, or frankly, protect our democracy. It is extremely important that people can trust data and facts and follow the science. But unfortunately, we've seen such a proliferation of misinformation on vaccines or whatever it is, that it's very hard to change behavior when it comes to those things. Just as it is difficult to convince someone that it's important to go vote. When I was at the Annenberg Public Policy Center, which I spent a number of years doing, we researched this issue of what changed people's behavior on things like voting. And what we found, which is pretty commonsensical, is that it's people's peer groups. Your family and friends are the most likely people who are going to change your opinion or your behavior on specific things, whether it's voting, or in this case, whether or not you believe in the efficacy of a vaccine or mitigation efforts for the pandemic. So what we've tried to do, similar to what Senator Chang mentioned, is that we try to reach those community groups. We try to find who are the peer influencers. In some cases, it might be your neighbor. It might be the members of your PTO. It might be a family member. Frankly, it might be a child in your home that comes back with information about why it's important to protect your health. We just have to find who are the peer groups that influence the members of the community who are just convinced that this is not the right thing to do, and we have to help bring that level of trust within those peer groups itself. And we have gone door to door. We try to reach out in every format possible. Some folks are just not going to be reached, unfortunately, because they've been so convinced, but we're doing everything we can to find those peer groups that are going to have the most relevant influence on the members of our community that need to hear this message.
As state and local electeds, what suggestions would you provide to the federal government to support you in your efforts? Because I think this is also, it cascades. We talk a lot about how, the recent infrastructure bill, how, all of that will help us in the post-pandemic world that we hope to be in soon. How can you, what suggestions would you offer to the federal government to help you do your jobs better in combating this misinformation and the challenges ahead, especially with flu season coming? So Mayor Nirenberg, I'll start with you.
Well, my simple answer to that in terms of the recovery of our local communities is pass, build back better. The efforts that our federal government is undertaking to provide for a recovery for our economy and getting residents back on their feet are significant. They're historic, and they need to happen for us to get it done. So we need to keep our residents housed. We need to keep folks employed, get them back into employment, and keep them healthy. And so those efforts are significant. I would also, as we have been talking about, and especially in our state, the more direct to local support and resources that they can provide, the better. And then again, be consistent with the science and with the data, and following the medical experts in the community as it relates to the pandemic.
Senator Chang.
Well, definitely want to agree with Mayor Nirenberg about the importance of Build Back Better. I mean, I just think that piece of legislation is so critical to every single American, and I know that us in Michigan are eagerly awaiting passage of Build Back Better, because we know it'll make a huge difference on childcare, combating climate change, just everything, so much more, healthcare, everything. So we've got a lot riding on that. So really hoping that, we can see that move forward as soon as possible. But, I think there's a couple things I was thinking about this question. One is that, there's so much valuable information that the CDC has. And we know that, figures like Dr. Fauci and others have been beloved by many, hated by others, but I think are such critical people in terms of relaying accurate information and guidance. And I know that many of our local governments and our state government, we look to the CDC for really strong guidance. And so I would just, in terms of one thing that's very simple, but I think that is just so needed, is for the CDC to just continue to provide strong leadership and strong guidance, especially as this pandemic continues to evolve, because, it is ever evolving. And then the other thing I was just thinking about, this is kind of going back, I don't even know, like half of a year now, but one of the issues that I've been working quite a lot on is, water shutoffs. And so the federal government, made possible money to help people with their arrearages. But there was quite a bit of lag time in terms of the government actually developing what the guidelines for that program would be. And so that caused a bit of a delay in terms of the state, and then others, coming up with what we were going to do. And so, obviously we've got to figure out some of the longer term solutions that I've also been working on related to water affordability and shutoff protections. But I think that it is really important that the federal government is responsive as they can be. And I know that they have been, but to just understand that, in situations like that, that providing guidance as quickly as possible on some of those really critical issues can really be the matter, can really be the difference, life and death for some people. And so just really grateful for the Biden administration and all of their leadership, and, would hope that we'll continue to see, just some really strong guidance moving forward on all of these fronts.
One of the things that has been, another adverse outcome from the pandemic has been the rhetoric that increased anti-Asian hate within the Asian American community, and, as an external factor to that. So, as elected leaders who identify with the Asian American community, how has this been? Has this been an issue for you in your districts, and with the constituents that you've had to maybe potentially protect because of that kind of rhetoric and the outcomes of that? So would like to hear your experiences in dealing with that. So Senator Chang, I'll start with you.
Sure. Yeah. So I just am thinking back to even actually February of last year when COVID hit the United States. It wasn't yet in Michigan. I just remember myself and Representative Padma Kupash, who represents another part of Detroit, of Michigan, coming together to do some press statements because we were really afraid of what was going to happen. And we urged people to stay away from xenophobic rhetoric and to respect one another and all these things. And unfortunately, what we thought was going to happen, has happened, and that we know that there have been thousands of Asian Americans across this country who have faced hate incidents, hate crimes, and discrimination. And it's really unacceptable. And I also think that the language that a number of people have used, at the highest levels of government on down, in the previous administration, basically promoting scapegoating of Asian Americans and Chinese Americans, or anyone who looks Chinese, associating us with the virus has been extremely harmful. And we see that by the many people, including our elders, who for literally just walking down the street have been viciously attacked. And so it is horrifying. And the good thing, though, is that I think that the Asian American community has really stood up and been very outspoken. And I feel like we've seen more activism this year at least compared to what I've seen in previous years. And so I hope that continues. In Michigan, we did pass resolutions condemning anti-Asian hate and discrimination and really encouraging people to report. And then I did secure some money in our state budget to help our Michigan Department of Civil Rights to do more Know Your Rights outreach, because we know that there are so many in our communities that still are afraid to report what's happened to them, or don't know why it's so important, or feel that if they report that nothing's going to happen. And so that outreach is so important to let people know that it is important, and that it's the way to hold people accountable. And it doesn't happen if people don't report what happens. And so, I think we're going to continue to push for more resources on the Know Your Rights front. And we also want to just continue to reach out to our community members as elected officials to let people know that we're here, and that we support them, and that we'll continue to stand against hate. And meanwhile, also continue to build bridges with other communities of color that we know that hate has been on the rise against many, many communities. And so we've just got to continue to all work together to see where our shared struggles are, and continue to promote a more welcoming Michigan in our case.
Mayor Nirenberg.
Yeah, I agree with all that. And unfortunately, San Antonio, despite being a majority community of color, in a state, by the way, in the new census, is a majority community of color, we have not been immune to the anti-Asian and anti-Semitic rhetoric and acts that we've seen increased in the last couple of years, particularly as previous political leaders and even some current political leaders have normalized that kind of hate. So what we've done, very similar. San Antonio is very quick to respond, and I think that's extremely important. We did also take up and swiftly pass a anti-hate resolution focused specifically on anti-Asian hate as well as anti-Semitism. We've seen it in online speech and vandalism. We've seen acts of aggression. So we wanted to stand up swiftly. We've also hosted rallies with the Asian American community, the Jewish community, and allies. And so the philosophy has been, when that kind of thing rears its head, we stamp it out very quickly. When hatred becomes visible, we get more visible, and we try to drown it out. That's the kind of community San Antonio is, and I think that that's extremely important, particularly in this moment.
Well, thank you for all that you do. I want to close this out with one last question, and you both basically touched on this as well in your last statements here. This idea of collaboration and working together with other communities of color. What's the one characteristic that is important for collaborating with our community so that we can be better allies and partners? So Mayor Nirenberg, I'll let you close us out, and then Senator Chang.
Well, so much of what we've seen with regard to this issue has to do with bottom line equity. We've seen communities of color most impacted because it's in these census tracts that we see all the other issues highly correlated. And so we have to focus across the board on equity, equitable access to vaccines and testing, access for services related to the economic recovery and employment, education, but it is a focus on equity. And I will say, San Antonio, I'm very proud of our community. For the last 5 years, since I became mayor, we have adopted an equity framework for simple things like our city budget. And we've done that consistently now and refined it over the last 5 years. Equity as a matter of governing we need to set expectations that generations of inequity and social inequality can't be fixed overnight. So, and a commitment to equity is going to take year after year after year, elected after elected, and people need to feel it at the polling booth as well. But I think it's a focus on equity.
Senator Chang.
Yeah, well, that's great to hear about the equity framework that you all are using. I think that every single level of government should be using an equity framework. In terms of, what I think is really important for collaboration with our community and, between various communities, I think that listening is such an important skill that as elected leaders, is one of the most important skills that we have. And also I think for our on the ground grassroots community leaders, being able to just really listen to one another. And so when you talk about, various communities of color working together, building bridges, finding ways to work together and identifying shared struggles and how to move forward. I think a lot of it is just honestly being able to listen and learn. I think that one of the things that's kind of emerged out of all the anti-Asian hate and at the same time of grappling with, the fact that in Michigan, we literally have not passed and sent to the governor's desk any meaningful police accountability legislation since the murder of George Floyd. And so, thinking about, especially Black and Asian communities, knowing that we need to work together more, it's just really taking the time to listen and learn from one another's shared histories and to remember that, much of what we are going through right now, we're going through together. And so we've got to be willing to listen and be willing to learn from one another. And that is, I think, the heart of, any good, true collaboration.
Well, thank you, Senator Chang. Thank you, Mayor Nirenberg, for participating today and providing your insight and all of your perspective as state and local elected leaders. It's so important for us to see Asian Americans in this role, and I hope to see more Asian Americans, Native Hawaiian, Pacific Islanders in elected leadership as we move forward in the progress of our country. So thank you to both of you for joining us today. And to our audience, we appreciate you for tuning in. Feel free to share this in the future to your network if you know of anyone who might find it of interest. And thank you to the Health Forum for having us as a partner in the Voices Conference. Tune in for the next panel discussion shortly.